The employer shared responsibility, also called the employer mandate, more commonly referred to as player pay. Player pay is the provision of the Affordable Care Act that requires an applicable large employer to offer minimum essential coverage that provides minimum value and is affordable to substantially all full-time employees and dependents, or be subject to tax penalties. If you must comply with player pay, you will need to understand all of those terms. And if you have been listening to this series of player pay webinars, you have heard that at the beginning of each of the training modules. We purposely are repeating this so that we can drill in that each of these terms are equally important and you will want to understand them all. If you do not comply with those items, you would be subject to tax penalties. So today's training will explain minimum essential coverage, minimum value, and affordability. Let's start by looking at how these three items kind of fit together. So at the top here, we have minimum essential coverage. All right, this is simply your health plan. This is what you must offer to your full-time employees and their dependents in order to avoid the no coverage or subsection A penalty. Now, within that health plan, it must meet two items, the minimum value standard and the affordability standard. Minimum value has to do with the value of benefits paid. Affordability has to do with the cost of the benefit to the employee. And both of those standards would need satisfied in order to avoid the inadequate coverage or the B penalty. And then you would need to offer your minimum essential coverage that meets those standards to your full-time employees and dependents. So we'll take each one of those and dig in a little bit deeper. A, quote, eligible employer-sponsored plan, a term that means a group health plan or group health insurance coverage offered by an employer to an employee that is a governmental plan, or any other plan or coverage offered in a state's small or large group market. So that would be any plan that a fully insured carrier is selling you. And then the IRS regulations did clarify if you are self-insured, your plan would qualify. So the minimum essential coverage definition does not go into a lot of detail about what that plan has to look like, what level of benefits it has to cover. So it is a very broad definition, and most of your plans would most likely meet that definition. Now, what it does not include would be accepted benefits, such as if you have an HRA that pays out only vision and dental themselves, health flexible spending account that is accepted. So it does have to be a major medical type of a health insurance plan. And know that to avoid this no coverage penalty, your minimum essential coverage is not required to meet that minimum value or affordability. Those two pieces come in to avoid the subsection B, or inadequate coverage penalty. All right, so your minimum essential coverage, simply a health insurance plan that you are offering employees. Now let's look at the minimum value and affordability. To avoid that inadequate B penalty, the minimum essential coverage that you offer your full-time employees and their dependents must meet both of these requirements. Your minimum value is measured for each health plan. That's the value of the plan itself. The affordability is measured for each of your full-time employees. So some may meet it, some may not. Minimum value. If your plan pays at least 60% of the total allowed cost of benefits provided under the plan, it will meet minimum value. There are safe harbors to determine whether your plan will meet this minimum value definition. The government has released a calculator. There is a checklist provided again by the government Or if you have a very complicated plan, you might need to get an actuarial certification. Fully insured plans, the insurance carriers, all of them that we work with in Iowa, they have done a very good job of providing detail to the employer to show that your plan would meet minimum value. So the insurance carriers are taking care of that. If you don't have something in writing from them, you will want to obtain that before your 2015 plan year. For a self-insured plan, you would want to work with your administrator, your benefit consultant, advisor, because that would be your responsibility to look at one of these safe harbors, make sure your plan meets the definition. So again, most plans are going to easily meet this or with just minimal changes to meet it. Now, we do want to note here that just recently, the IRS released a notice that indicated the skinny plans would not meet minimum value, even though they might pass the qualifications in the checklist or the calculator. So a skinny plan is a plan that might not cover any hospitalization or any physician services. It's bare bones, and maybe it only covers, the required preventive care at an unlimited amount. And what has happened is some employers, of course, have gotten very creative, and they pass the minimum value test with these plans. The government has come out and said, no, that's not going to work. So if that is an issue for you, that skinny plan may still meet the MEC, the minimum essential coverage requirement, but it won't meet this minimum value. If that's an issue for you, we can provide more information. Now let's look at affordability. Again, this is measured per employee. So if the employee's contribution toward the lowest cost single premium does not exceed 9.5% of their income, the affordability is met for that employee. So you are going to measure this, always using the contribution for the single contract only, regardless of what that employee is enrolled in. They could be enrolled in a family contract. You're still going to look at only the single contribution. Contribution of the lowest cost plan that meets minimum value. Again, regardless of which plan the employee is enrolled in, you're going to measure using the lowest cost plan that meets minimum value. And you're going to compare that contribution to the income of that employee based on one of the three safe harbors. At the bottom here, we have put a note. You may have read that the percentage for 2015 has increased to 9.56. This is an indexed amount, and that is, in fact, a new percentage, and that would be of household income. However, the safe harbors piece of the regulations are separate from that, and those did not change. So you will need to continue with the 9.5% in your calculations. Now, I won't go through this slide, but just so that you can view this later if you want. Okay, the three safe harbor options to determine affordability: W-2 income, rate of pay, and the federal poverty line for a single individual. You may use one or more of these safe harbors for all of your employees, or you can split your employees up some and use one for one category, another safe harbor for another, if that's easier and makes sense for you to do that. The categories are listed here that you may use. Now we'll go through those three safe harbors, show you how they work. W-2, you are measuring this on a calendar year basis. You are measuring at the end of the year. For example, to determine your 2015 affordability, you're using that W-2 issued in January of 16, so it's after the fact. You will compare the employee's premium contribution for the year, again for that lowest cost, minimum value, self-only coverage, to 9.5% of that employee's W-2 income, box 1, This box 1 does not include pre-tax deductions, but if you're using the W-2 safe harbor, that is what you need to use. So if their premium contribution does not exceed 9.5% of that W-2 amount, affordability is met for that employee. Now let's look at this. Okay, this is the same example I just showed you above. 150 a month is what we're measuring. This employee earns 34,555. Take that times 9.5%. So we are comparing this 3,282 to 1,800. Because the W-2, we're looking on an annual amount, so I took that 150 times 12. This employee would meet affordability because the 1,800 does not exceed 9.5% of that W-2 income. A few additional items on the W-2. The employee's contribution must remain a consistent amount or a consistent percentage of that W-2 income for the calendar year, or each portion of the plan year that falls within the calendar year. If you have a non-calendar year plan, that amount will and can change at the beginning of your plan year, let's say July 1. Also, you can make an adjustment if you have an employee who is not full-time for the full year. Let's say you have a new hire in July, you have a 30-day wait, they don't come on the plan until 9/1. So you can adjust that W-2 to match the time period that you were actually offering coverage. Now the rate of pay, the second safe harbor. This is measured on a monthly basis. You are comparing, again, the employee's premium contribution for the lowest cost minimum value self-only coverage to 9.5% of their monthly rate of pay. Now, if it's an hourly employee, you are going to use 130 hours per month times the lower of the rate at the beginning of the plan year, or if different, the lowest rate of pay during the month if less than that rate at the beginning of the year. You are going to use 130 hours per month regardless of what they actually work. So if they work more, less, doesn't matter. You are going to stick with that 130. So the way this is designed, at the beginning of the plan year, you have an employee that makes X amount per hour. You take that times 130, and that is what you are going to use for their pay for comparison for the entire plan year. And the only change you're going to make to that is if that reduces, then you're going to reduce that. That's hourly. For salaried, you would use the monthly salary at the beginning of the plan year. Now, salaried employees, if that amount is reduced, you cannot use this safe harbor, and the regulations indicate that even if that reduction is due to a reduction in hours. So for the salary employee, you're going to use their salary beginning of the plan year, and that is what you're going to use all year, even if it increases, but if it decreases, you cannot use that safe harbor for that employee. And if the premium contribution does not exceed 9.5%, you will meet affordability for that employee for that month. So the example here for the rate of pay, using the same top piece, that 150 per month, this employee makes $1,550. Apply the 130 hours, we get the monthly times 9.5%, compare 191.43 to 150, affordability is met. Now the last safe harbor is the federal poverty line. If you can use this, if you meet these provisions, this is going to be by far the easiest method for you. And for any of you who are paying 100% of the single premium, you will meet this guideline. So this is measured on a monthly basis. You are going to compare the employee's required premium contribution for the month, lowest cost, self-only coverage, to 9.5% of the federal poverty line for a single individual, divided by 12. Okay, so for 2015, that annual number is 11,670. I take that times my 9.5, I get 1108. 65 divided by 12 is 9239. So $92.39 per month is the contribution I'm going to use for all employees regardless of their pay. You can, so that you have time to prepare, you can use the federal poverty line that is in effect 6 months before your plan year. And then, as with the other safe harbors, if the premium contribution does not exceed that amount, affordability is met for that month. So the way this would look, I've got $150 per month. Now, this example, the employee is not going to meet because my employee has to meet $150. That exceeds the $92.39, so we do not meet affordability in this example. Now, I won't go through this slide, but just so that you can view this later if you want. A lot of tiny print here, so you'll have to print it out probably on a larger 8.5 by 11 page. But this shows you the examples we have gone through today side by side and how those compare. A couple of notes on affordability. If you have a wellness program where you provide an incentive or disincentive that affects that premium contribution, or if you have an HRA where employees can use part of that money in the HRA to pay premium, you will want to gather additional information because this may affect your affordability. Okay, our regular disclaimer, while the information is factual, we are not a legal firm or an accounting firm, so it is not construed as legal or accounting advice. And if you have any questions on this or any of the other training modules, please contact us via email, via telephone. My name is Susie Pinkney. My information is down at the bottom here. And then you may also contact Terry Farrell-Coe, Mark Becker over here. Any of us would be glad to help you. And thank you for joining us today.